Good evening, everyone. I am Arpita from the IGCP group. A warm welcome to today's webinar on alcoholic cirrhosis, the quiet liver damage behind the cheers. This session aims to shed light on the often overlooked and silent progression of liver damage associated with chronic alcohol use, an important topic for clinicians, caregivers, and healthcare providers involved in early detection, patient counseling, and long term management. Now, I would like to introduce our moderator for today's session, none other than Professor Dr. I.B. Vijayalakshmi ma'am, who is already known to all of us. Still, a bit of introduction to set the stage. So, ma'am is a Professor Emeritus, former HOD of Pediatric Cardiology at Sri Jayadeva Institute of Cardiovascular Sciences and Research, skilled interventionalist, pioneer in pediatric cardiology. He's a president of Indian Academy of Echocardiography. A brilliant academic career, ma'am has secured 22 gold medals. Proposed the echo criteria for the early and precise diagnosis of carditis in acute rheumatic fever and national policy for congenital heart disease. Best Presentation Award ma'am has received at the PICS at Chicago and in Boston. She has received first prize for outstanding scientific presentation at World Congress of Echocardiography, has received many prestigious awards for her academic and literary work. She has 52 publications, 105 research papers, among which 32 are international, on her own credit. She has delivered 210 scientific lectures authored step by step to ECHO in CHD and edited monogram on ARF and RHD. So, ma'am, with this introduction, I would now request you to please start with the topic. Over to you, ma'am.
Yeah. Good evening, everyone. I'm in the transplant committee permission here in Karnataka. And to my utter shock, one person who was just 37 years old, engineer, he came for the liver failure and the liver transplant. And who was giving the liver to him? The live donor, his mother in law was giving. And I was shocked. The mother in law is 52. And then he is only 37. And I asked him, when did you start taking alcohol? He said, when he joined the engineering college, the very first semester he started taking. And now he's 37, father of two children, and already in liver failure. And that's what shocked me. And then when I looked at the whole data in Bengaluru, almost 28% of the college going students have taken alcohol. And that is a big number. We were only hearing that in Russia, the vodka drinking is too much. In Kerala, this is the big problem, and the government is worried. But then the college going and the school children have started drinking. So I thought we should listen to the experts so that both the doctors as well as the public will realize how important it is to not to drink the alcohol. And that's how we know this topic. And Dr. Pawan gave the thing that the cheers, it though they say cheers, but it is not cheering. In fact, they're losing their brain cells as well as the liver. It is not just the liver. The alcoholic gastritis, alcoholic Saturday night syndrome, and then every time they booze, the eyes will be red, and the red eyes only are the windows to the brain. And then there will be rheology will change, and the clogging of the capillaries and the rupture. And every time a person drinks, 8 to 10,000 brain cells are gone. And so let us start with the first speaker, that is Dr. Pawan. Uh, yeah, welcome,
Hi,
Dr. Pawan. It's a pleasure to have you. Can I have his
good evening.
introduction slide? Yeah.
Good evening,
Both,
ma'am. Good evening,
yeah,
everyone.
good evening. Yeah, Dr. Pawan is, he's, oh God, can you, okay, one second. He is the head consultant at hepatology, liver transplant physician, and the gastroenterologist in the Jupiter Hospital in Pune. And recently I heard him speak And then his presentation was so brilliant. I thought that his talk should be an eye opener for everyone, and that's how I invited him. And his clinical interest spans from the liver disease diagnosis to the liver transplantation, and he has got a very large experience. And now I ask Dr. Hanchnal to tell us. Next slide, please. Next slide. No, the questions. Okay. What is the burden of alcohol related diseases all over the world? More than the world, I'm worried about the current scenario in India. What is happening to our youngsters? And the next question I would like you to address is, what are the types of alcohol that are consumed? Are they safe? And how much to, what is the limit? Because many people have the myth that just 30 ounce will increase the HDL cholesterol and their heart will be better. So at what cost? If you want to have the heart and lose the liver, and that is the thing. And the liver is, it is almost like a kitchen, and without that we cannot survive. So how does the alcohol affect the liver, and what are the stages, how gradually it is affected, and what are the stages? Are there any differences in the alcohol related liver disease and in the male and the female? Because everybody says that the ill effects of anything is more on the women, and as a result, nowadays more women are taking up. And in fact, it is not a satire, it is the truth. See, after that I told my daughter, oh my god, look at that. You have, when a daughter is born, you have to get her married, give the dowry and do everything, and now the mother-in-law has to give the liver also to the son-in-law. What a terrible thing, I said. Then my daughter said, Amma, you go only with the good people, so you do not know. Now women also have started drinking, and after 10 or 15 years, mother-in-law also will not be available for donating the liver. In fact, she'll be a recipient, she said. So what is the difference between the alcohol consumption in men and the women, and what is the effect, and what is the treatment of alcohol related diseases? Over to you, Dr. Pavan. Please tell us and give us an insight into this alcohol related liver diseases. Thank you.
Yes. Thank you for the kind introduction, ma'am. It's indeed my privilege to be here sharing a dais with you. And let's start the discussion, I think. So I have five, I think, questions here, which I will discuss in a brief. I will take maybe 10-15 minutes, not more than that. So let's start with the first question. Will I be able to change a slide, or you will change side will be changed from that side?
So you can change it.
Okay, fine. Okay, so looking at the, so how do I change
Go
slide?
to
Okay,
the
fine.
next. Yeah, share your
Understood,
screen.
understood. Correct. Okay. So let's start with the burden of the liver alcohol, and basically the burden of alcohol-related liver disease across the world and India is progressively increasing. That ma'am has correctly pointed out, and the numbers are more and more, many more to come. I think since the amount of breweries which are coming up in and around us, we can actually see how much amount of alcohol is actually getting consumed. There is a lot of data which was there recently in between Times of India as well as in Indian Express in last few years, that amount of alcohol, the consumption of alcohol per capita is increasing, is grossly increasing. So this is a
And
WHO data.
if I am permitted to interrupt, in fact,
Yes, yes,
during
ma'am.
the corona, the people were lining up. So we
Yeah,
thought they're lining up to buy the groceries. No, they were lining up in front of the wine shops, to stock the alcohol. And in
true.
fact, after corona, the consumption has doubled or tripled. This is what
Yeah.
is seen in the metropolitan cities, and that's a disturbing one.
Yeah, and the consumption is increasing equally in urban as well as rural population. I don't think it's only
Okay,
urbanized problem,
okay,
but
okay.
it is there equally in both the sides. So the WHO has found that harmful use of alcohol-related deaths is around 2.6 million deaths are happening worldwide annually, and
Oh my
roughly
God.
which is of 4.7% of all the deaths. So these are
Hmm.
alcohol-related deaths only happening worldwide. Especially in youths, the youths are specifically impacted between 20 to 40 years of age because of the harmful alcohol use. And obviously, this will lead to increased risk factors for premature death as well as disability because of the
Yeah.
accidents and multiple reasons. So the data shows this is ICMR and WHO data I'm clubbing. So 13% of the deaths in this age group are attributable to the alcohol. So which is quite a big number. So then these are
Yes.
self-inflicted problem. This is not what is
Yes.
happening
Yes.
because of the genetics or something else. So this is our own creation. So I think this can still be modified. I hope this will get modified after this lecture.
Good.
Yes,
That's
ma'am.
a
So
positivity. And in fact, just yesterday, during the party, I saw a young boy, doctor, 25 years old doctor, he was trying to hide the glass. Then I asked, what are you drinking? The surprisingly, his father is also drinking, he is also drinking. When I told him, he said, okay, madam, I'll stop drinking, he said. But that everybody will not say, just because
yes.
by our lecture they will not, but at least they must realize that it is a very serious matter and they cannot waste their life. Yeah, please
Right.
go ahead.
A lot of social drinking is increased, as you correctly pointed out, and there is a thin line between the social drinking versus going into a harmful drinking, because we
Yes.
do not know what is a safe limit. Anyways, we are going to come there. So this is just a diagrammatic pictorial presentation. This is AI generated. I have not done it. I've just fed the data there. So this is the maximum amount of alcohol consumption which happens in the northeastern states.
Hmm.
Fortunately, but yes, Maharashtra is leading afterwards, and we know Goa
Wow.
and everything. Yeah, so I
I
think
know. I
yes,
know.
so amount of alcohol is going up in all the states in India across all the states. So now coming to the next question, just a moment, just let me go on. So
What
coming
are
to
the
the next
types of
question, what are the
alcohol?
types of alcohol, and is there any safe limit for consumption? So, if you ask me, this is clear cut no. So, there is nothing safe about alcohol, and there is no safe limit of alcohol consumption. That 15 ml or 30 ml of alcohol in whatever form, if consumed, that will save your liver, save your heart or rest of the organs. There is nothing true about it. So, this is also supported by WHO and Lancet articles, which have said that there is no level of alcohol consumption which is safer for the health, and this
Yeah.
is the truth. So this is what we all need to remember, that uh, this is going to cause some or other problems. This might not be evident now, but if it goes on, then we will see it later on in our life. Yes, ma'am.
Yeah, here I would like to add, in fact, when I'm talking to the college students, I show the slide. The bottles are labeled as doctor, advocate, engineer, and and this is how. And people, the stupid young children, they think that by drinking doctors or the engineer or the advocate or whatever it is, they are going to become like, no, they are going to destroy, and that they have to be very careful. The label also is very bad,
I understand, ma'am. Teachers and all. Yes, ma'am. Okay. So next question, I think we'll go to the next one. So what is actually a standard alcohol? So how do we measure it? So a lot of patients who come to us, they tell, I take only beer, I take only wine. It's not hard. So I think that's not much of alcohol, is it? That's what the basic question. और इतना क्या होता है उसमें से? ये तो normal है. 4% alcohol में क्या होगा? So these are the few standard comments when we get all the patients to the clinic. So I would like to tell everyone that how do we, in a medical terminology, how we calculate alcohol. So if you see beer, wine, and hard liquor, so this is how we actually divide amount of alcohol. So all hard liquor, including, so what is hard liquor is that 40% weight by volume is in India at least. Uh, so this is 40% and above. Those are all stronger hard liquors. So which is whiskey, rum, gin, brandy, single malts, everything falls into that category. Then comes a category of wine where the amount of alcohol is a bit less, and the least is in the beer. So if you see, one standard peg in the standard medical calculation is 14 grams of alcohol. So what is 14 grams of alcohol is like one peg of whiskey is equal to consumption of 150 ml of wine is equal to consumption of 330 ml or 350 ml of beer. Grossly you can take it. So this is how we remember amount of alcohol consumption. Why it is important? Because a lot of people come to me and say, I drink only 2 beers. I don't think I am drinking more. But 2 beers or 500 ml of each can of two can, that means they're drinking around a liter of beer. That means you can calculate is as good as 3 pegs of whiskey they're drinking. They do not understand
Yes,
that. So
yes,
this is what I want to say. People have been saying that wine is good for health. Uh, I have no obvious scientific evidence for that. But yes, if you drink more wine, so if you drink 3 glasses of wine, is as good as having 3 pegs of whiskey. So that is what we all need to remember is that so it's not like whiskey is bad. Another misconception everyone has, or at least people who coming to me, that there we have patients from a poorer class versus we have industrialists who are coming to us. They tell that I drink only scotch, I drink only actually a foreign
as if
liquor not made in
the scotch
India.
is amrut,
Correct.
as if scotch
Correct.
is amrut.
So we have a Amrut called liquor in India, in Indian single malt Amrut. If you tell me, if you ask me that, so all this, even a refined whiskey, will cause liver damage and liver failure. Versus the people who are having a country liquor, that will also cause liver problem. So it's nothing that if you are having a single malt that is really good for the liver. Liver doesn't understand what you're drinking. It doesn't only
Yes,
understand that you're drinking alcohol, and it is going
yes,
to get reacted to that. So this is all
yes,
what we need to remember. There's nothing good about country liquor versus single malt versus beer versus wine. To me, all are same amount of alcohol, and the damage which they are going to cause is equally bad. So
yes.
I think we all need to remember that
And not
about
only the
this.
amount, the way it is prepared. When I
Yeah.
went to Lisboa, we were taken to Porto. The Porto wine is supposed to be the world famous wine. My goodness, the way they smash with the legs, almost like Vitova dancing Vittal Vittal with the thing, the way that they mash it, and it is so absolutely dirty and so bad. And the barrels are there for decades, and the older the wine, the better, they say. But
Yeah.
God only knows, what it is. And then, the cocktail is supposed to be still worse. So you can go ahead.
Yes, ma'am. So this is about some details about the alcohol types and the amount of alcohol in them. Now, let's see how do they affect? What is how does a liver affect alcohol affects the liver? So if you see here, I don't have a pointer here. So first, if you see first diagram on the right hand side is a healthy liver. So once we start consuming
You
alcohol or a
use your
person starts,
arrow can be used.
this still works.
Yeah, the arrow
Okay.
can be used. Okay.
Okay, fine. So this is seen, right? So this is a healthy liver, what I am
Hmm.
trying to say. So
Yeah,
healthy liver, once you start drinking alcohol, liver will go liver the basically this alcohol is stored in
it
the liver as
bloats.
a fat. Correct. So it
Yeah,
bloats. It's called as liver steatosis.
fatty
So
liver. Yeah.
accumulation of fat. So alcohol, once it is detoxified, it is stored in the form of fats in the liver.
Hmm.
This is called as alcoholic hepatitis or alcoholic steatosis. And
Hmm.
this steatosis, if you continue to drink more, this will go in the stage called as alcohol-related hepatitis. So
Hmm.
hepatitis in the layman term is inflammation of the liver. So
Yes.
liver will get inflamed because of many causes. One is alcohol, another is drugs, another is viruses, and
Hmm.
even a simple. So there is another term also called as non-alcohol hepatitis.
Yeah.
Non-alcoholic hepatitis. Nowadays we call this metabolic steatohepatitis. That is different discussion altogether. So
Okay.
here we are talking about alcohol-related fatty liver converting into steatohepatitis. That's alcoholic hepatitis, and finally this alcoholic hepatitis will end up in liver cirrhosis. So
Can
these are the
all these
stages.
changes, be made out on the just ultrasound, or anything else has to be done for the thing?
Correct.
Because what you're showing is all right, but for the people to understand these stages,
Yeah.
Are they detected by the ultrasound, or they have to get the special test?
So to identify this, ma'am, we need two things. One is blood test and another is imaging. So if you
Okay.
do the blood test, a person who is consuming alcohol in a significant amount, or even whoever is consuming in whatever amount they want to check their liver health, they have
Hmm.
to do some blood test called as liver function test, which has
Yes.
10, 11 parameters, where we will understand how much amount of alcohol is liver is getting affected because of.
Hmm.
There are parameters called as SGOT, SGPT, bilirubin.
SGPT. Yeah.
So bilirubin, alkaline phosphatase, gamma GT. So out of which SGOT and gamma GT will start increasing as the liver starts affecting the liver gets affected because of alcohol. And once you see that, so this is called as inflammation. That is called as hepatitis, which is happening. This is a milder
Okay.
form of hepatitis. In a
Hmm.
severe form of hepatitis, the enzymes will go in two digits or three digits. Like SGOT, SGPT will go in hundreds and two hundreds
They
range.
become high,
GGT.
very high. Yeah.
Yes, so they starts going up, and the gamma GT will start increasing. In severe form, you will see jaundice. So bilirubin starts going up, and people will
Hmm.
say eyes are getting yellow, the
Hmm.
urine is becoming yellow, the
Hmm.
skin is you will find it yellow. So this is
Hmm.
a severe form of alcoholic hepatitis, where
Hmm.
even people will have pain in the right side of the abdomen. Sometimes you will have a
Hmm.
rash over the arms and legs. All these things will happen. This is called as alcoholic
And
hepatitis.
apart from that, they can have the spider nevi, I
Correct.
have
So that is
seen one
spider nevi.
lady from Goa. She used to
Yeah.
drink fenny, and then the huge spider nevi, when you press, they blanch and then again they fill up, and that is
Correct.
the
Correct.
diagnostic of alcoholic
Correct.
cirrhosis.
Correct.
Yeah.
So
Yeah.
clinically, it's very, very diagnostic. If you have a spider nevi and you find it, then the diagnosis is almost done. That yes, there are other reasons for spider nevi, but commonest is alcohol. So any
Alcohol. Yeah.
inflammation, acute inflammation, severe inflammation, spider nevis will come up.
Hmm.
And so these are the some blood tests. So in imaging wise, so you can
Hmm.
do a ultrasound. Ultrasound, you
Hmm.
will see liver is size is getting enlarged. One. Secondly, it will become fatty. Two. So you
Hmm.
will see a fatty liver in ultrasound reports. And
Hmm.
in severe stages, you might also see altered ecotexture of the liver, liver becoming cirrhotic.
Oh,
So liver
yeah.
will change its size and shape
The
once it
nodules
starts
will be
getting
there.
damaged. So
Hmm.
yes, the liver will surface, you can see the surface is nodular. You will
Hmm.
see some amount of nodule formation in the liver on ultrasound. This is
Hmm.
best seen on MRI if you have to,
Okay.
but ultrasound will catch it early. Yes.
Okay. Hmm.
Nowadays, what we do is a fibroscan. So it's
Yes.
elastography. So
Yes.
this is one of the important tests where you will find the liver is getting hard. Any disease of the liver is usually a soft organ like our cheek. Once
Yes.
the disease starts, the liver will starts becoming a harder because of the scarring which
Harder.
is happening
Like a
harder.
scar.
Yeah,
Yeah.
because of the repeated scarring and injury inside the liver because of the alcohol. And this scarring is diagnosed by fibroscan, where the values will start going up. There are values like kpa values which will start going up, and then we see the stages of fibrosis.
Hmm.
And on these are non-invasive tests, we don't have to poke anyone, so they're like
Yes.
taking images of the liver. So fibroscan or mr elastography or ultrasound elastography, these are the newer tests where we find out indirectly how much liver is getting scarred because of
Yeah.
alcohol, and accordingly we can tell the stages, and even that can diagnose a cirrhosis also.
Okay.
So these are
So
the
you
few
don't
tests.
have to do the liver biopsy like in the past, such a long
Yeah.
needle we used to poke and all that. Now that is not required because
So
of this
correct.
ultrasound.
So
Yeah.
biopsies might be still be required in the end if you really have
Yeah.
to start a therapy, or but in very small percentage of cases,
Yes.
not really
Hmm.
commonly done. So blood test and imaging will diagnose the stage of the liver disease. So for that you need to actually consult a nearby hepatologist or gastroenterologist. They will tell you how to go about it. So at least
Oh,
do a liver function test. You will understand the liver
okay.
function test. So but important thing you all should remember that a normal liver function test doesn't mean the liver is normal, because liver will
Okay.
still will get affected,
Yes,
because liver has
yes,
a
yes.
good reserves. Liver will get actually affected later on in the liver parameters. So
No,
it
it is
doesn't mean
like,
that, so
the
because there's a lot
patient
of
comes
people.
with the chest pain and we do the ECG. ECG will be normal, though there is a heart attack. So that way,
Yeah.
in early stages, it may not be detected on that. Yeah. You
Yeah,
are
so
right.
a lot of patients come to me because they get liver function test with me. They tell say my liver function is normal. I'm still drinking. I am not really worried. Well, I am telling everyone, you don't worry about that. Even if you check LFT every daily and you keep drinking, suddenly you will
Hmm.
find that liver is scarred because you will not find
One
this.
day.
None of these tests are really a gold standard one to find the amount of damage because it's a silently
The
damaging
rock.
it
Yeah, yeah,
in the
yeah.
background.
It's a
So,
silent
so
killer.
it's a silent killer. So this is how we diagnose alcohol-related liver disease. Important thing, cirrhosis once it is developed, it is not reversible. If have
Reversible.
to reverse liver-related injuries because of alcohol, that needs to be done prior to near alcoholic hepatitis, or best is to alcoholic steatosis, where we can actually stop drinking and the liver will start improving from here.
Okay.
Another question, what a lot of people, patients ask me is, I have stopped alcohol since last 2 weeks. Now my liver should get better. So there is no correlation that because you're drinking since many years. A simple answer from my side to them is that if you're drinking for like 6 years, you will take so many years to come back to a normal. So don't tell me that you stopped alcohol since
Okay.
2 weeks while liver is not improving,
Hmm.
because it is a slow process. It takes time.
The
At
same
least
thing happens with the smoking also. Just because they stop
true.
smoking, the blood vessels are not going to become normal in
No.
no time. Yeah,
Because
correct.
the remodeling is the word. So
It
remodeling
takes
happens over
time.
the period of years, and it takes
Yeah,
years to reverse. If at all it has to reverse, sometimes it won't. So better is to stop in early stages, because cirrhosis is not reversible, and cirrhosis
yeah.
will lead into complications, and even liver cancers are common in patients with alcohol related liver because of alcohol consumption. So these are the few problems we all need to remember.
Okay, very nice.
So, correct. So now differences between male and female. Yes, women are more vulnerable for alcohol-related liver disease as compared to the men. If you compare the same amount of alcohol consumed between these two people, and this the difference is because of the biological, metabolic, and hormonal changes. So,
Or maybe your size is small, like
correct.
how the
So
cardiac blood
yes,
vessels are small, and
true,
I
true.
don't know. Okay.
Yeah, we are correct. Yeah. So the size is also small, the structure is small, the liver surface, everything, the surface area
The
is also
function is
smaller as
small.
compared to the
Small.
men. So generally, the data shows that women need 40 to 60% less alcohol exposure than men to develop the same degree of liver damage. And that is
Okay.
because of the low gastric alcohol dehydrogenase. These are the enzymes
Hmm.
which are needed to detoxify the liver, or breaking down alcohol when alcohol is consumed. This is a gastric ADH what we are talking about,
Yeah,
because
I
the
think this slide and this talk of yours, all the women should listen, because the come the
Hmm.
New Year's Day and our brigade, is filled with all the girls falling on the street, and I think everyone should realize how important it is to keep away from this. Excellent.
Correct,
Please go ahead,
correct,
sir.
correct. So these are the few parameters. So higher body fat, low body water as compared to men, and this all in conglomeration will result in more alcohol concentration in the blood in women, and there are more risk of alcohol-related liver damage. Even a smaller amount and smaller years of consumption will lead to alcohol-related cirrhosis as compared to men. So this is
Hmm.
one thing we all need to remember.
Hmm.
Now, what is the treatment of alcohol-related liver disease? The treatment is to stop alcohol first, because this is the first
Correct.
line. Stop, stop, stop. This we need to stop alcohol to start a therapy, because there is not many medicines to cure liver-related hepatitis, or
Correct.
cirrhosis is completely not curable. So once we stop alcohol, then the major aim is on nutrition. So we need to maintain the
Yes.
nutrition at the best level, which is a good high caloric diet like 30 to 40 kilocalories per day, and high protein diet,
Hmm.
and treat the deficiencies nutrition, especially thiamine, B12 deficiencies. These are because the alcohol consumes these multivitamins for the digestion part or metabolism part,
Yes.
so we need to
Yes.
replenish these enzymes. If patient has a jaundice or hepatitis, definitely, that means if a person who is consuming an alcohol does a liver function test after listening to this talk, and if the liver function tests are abnormal in any way, especially SGOT-PT or GGT, look at that. Please do consult your hepatologist or gastroenterologist nearby, because you will need evaluation. We need to find out amount of damage which has caused because of this alcohol, and so that we can tell you how much is it is reversible, if at all it is reversible, and by what means. Because medications, there are no gold standard medications to reverse its effect. All are antioxidants and supportive care after stopping alcohol. So nutritional therapy and the medication comes. There are few medications what we try in alcohol related hepatitis or in jaundice patients, but those all are supportive. So ऐसा रामबाण कोई दवाई नहीं है कि एक दवाई दे दिया
No, it is
एंड
not
लिवर ठीक हो गया.
possible
So
because the
this is
damage
what
is
we
so
all
extensive. Yeah.
correct. So this is about hepatitis and jaundice. Now we come to a cirrhosis. This is important. Once the cirrhosis is developed because of alcohol, cirrhosis is not reversible, not at all reversible. So there are three stages of liver cirrhosis: stage A, stage B, and stage C of cirrhosis. Stage A
Okay.
of cirrhosis is completely, most of the times it is silent because people do not know that they even some people who are listening to this talk might not be having cirrhosis, but they do not know, but they will be having cirrhosis unless until we diagnose them. They will not be knowing because it's a silent disease. The commonest presentation is low platelets or change in the liver echo texture on the ultrasound. So these are the
Yeah.
few earlier signs to pick up cirrhosis in stage
Yes.
A because they don't have a complications. In stage B, the
Correct.
liver disease-related complications will start, where you will find jaundice, you will find edema, that is, legs are swollen, you will find ascites, means accumulation of water in the tummy. This will start, or people will have a blood vomiting, or eyes are becoming yellow. All these things, or patient will become encephalopathic, means blabbering something or going into deep sleep. So these are
And
the
the
complications
flapping
of
tremors will
cirrhosis.
come
Correct.
once they come to the last stage.
Correct,
Yeah.
correct. So flapping tremors, encephalopathy, and people even they can go into coma. So these
Coma.
are cirrhosis stage B and stage C of cirrhosis. So once patient enters into cirrhosis stage, the only medical management is supportive, and we are generally following them regularly to find out if at all they develop a complication. We need to catch them early and treat them, whatever way it possible. So we can't treat the root cause now. Now we are
Yeah.
moving towards treating of complications of cirrhosis. The
Complications. Yeah.
important correct. So complications means ascites, encephalopathy, bleeding, so loss of muscle in liver cirrhosis is very, very important because these are the
Yes.
people.
Yes.
This is called as sarcopenia. So any
Yeah.
patient with
The hands
cirrhosis
will
who
be
has
very
lost
thin and the legs
correct.
will be swollen. Yeah.
Correct. So hand and legs both are completely thin. Leg feet will be swollen. Tummy will be swollen because of the
Tummy
ascites.
will
This is
be
called
big.
as
Yeah.
correct. So this is typically sarcopenia, loss of muscle mass, and these are the people who will do worse in patient with cirrhosis because they will get more and more complications after muscles are lost. And
Okay.
finally, once this reach a stage of stage C cirrhosis or these complications of liver cirrhosis starts developing, the only way for this patient is liver transplant because that is the only thing to cure this liver which is really not working well or not really coping up. So this is how we treat a patient with alcohol-related liver disease, from nutrition management, treating hepatitis, treating cirrhosis-related complication, and ultimately landing up into liver transplant because liver is not recovering in spite of stopping alcohol, in spite of best medical support. And
Okay.
so I'm sure
Yeah.
Dr. Sunil, next
Thank
speaker,
you
will
very
cover
much.
rest of
Thank
the
you very
things.
much,
Yes.
Dr. Pawan. So
Thank you, ma'am.
beautifully and so simply you have explained, and I think anyone with some sense they should understand. Now we move on to the
Yes, ma'am.
next speaker, Dr. Sunil Shenwe. Can I have the slide of his intro? He's a multi-transplant surgeon, and he worked in the west and then now he has come back. He did his mch in GI surgery from the PGI Chandigarh, and then he was trained abroad, and the work he worked also there, and he has presented extensive major international and national surgical conferences, and he's not only the liver transplant, he can do any other all multi-organ transplant. So Sunil, I have a few questions to you. Can I have the next slide, please?
Thank you. Thanks for the introduction, ma'am, and thanks for
Yeah.
having me here.
Yeah,
Can I
please
briefly go through a couple of
go
slides and
please.
then we
Yeah,
can?
yeah, please go ahead.
So, can I have my slides, please?
Yeah, you just click and start presenting. You can handle yourself.
So you need to upload them again.
Oh, I need to upload them again. Okay, sorry.
You go to that TV and press, and then
Yeah, it's being shown here now. Can you see?
no, not it.
Just a minute, sir. Yes, yes, it's there.
Yes,
Yeah.
yeah, yeah, it's there.
Yeah, yeah. Thank you so much, ma'am. And this is like I have some slides, and I have deliberately simplified these slides to the level of medical students, so many people can understand.
Yes,
So I'm going to talk about alcoholic liver disease and the role of liver transplantation. Thanks to Dr. Pawan and you, ma'am, because you have covered the basics so nicely so far. My job is going to become simple. So.
now, in fact, your job as a transplant surgeon is a big one,
Yeah,
We were talking about the prevention and scaring them, but wait, you have to treat them. Please go
yes,
ahead.
ma'am. And then you were also speaking about the ethical dilemma we have, no? People with alcoholic liver disease, which is a self-inflicted liver problem, and then going for transplant, especially somebody is willing to be a live donor. So I'll
Hmm.
briefly touch about it. So this we already discussed. ALD is a major global cause of liver-related morbidity, including it's a big problem in India. And we need to understand that, as you already told, it is not only the liver. So the
All the
alcohol,
organs are.
all the organs of the body, and as you discussed, it's a silent killer, and many of the
Yes,
patients don't know that their liver is getting damaged till
damaged.
they
Yes,
present with the last stage of the disease.
yes,
And with the advent of liver transplantation, the facility of liver transplantation being available, it can save lot of lives in patients who are suffering from liver related disorders secondary to alcohol. So there are a lot of definitions. I'm not going to go into that, but we need to understand that, like for example, we know that obesity is also a lifestyle related disease, and we currently we see a lot of patients who have fatty liver, which is also a lifestyle disease. All those patients we don't discriminate, even if they have obesity and then they become they come to us with liver problem, we treat them. Similarly, we should not, if somebody has got into liver problem because of alcohol, and if they want to survive and if they want to change themselves, we should not discriminate them. We should give them opportunity to live longer after undergoing
yes,
liver transplantation,
yes,
provided
yes,
that we are sure that they are not going to go back to alcohol. So that's very important.
yes.
So we discussed, Dr. Pawan briefly, in detail discussed about this. I'm just going to touch it in brief. The standard drink, what we say is 10 gram of pure alcohol, and we know different drinks have different concentration of alcohol. We also have something called as binge drinking. So binge drinking means nowadays all these youngsters, or like even the
This we
grown-up
call it
adults.
as a Saturday night syndrome, and
Yeah,
they
yeah,
fall unconscious and they may not come back
yeah. That's
because
in
they'll
women.
have the cardiac arrhythmias and the cardiac
Yeah.
arrest.
Yes, ma'am. So that's like we say, and we discussed, Dr. Pawan discussed in detail, women, if it is more than four drinks or in a short duration of time, and in men, more than five drinks in a short duration of time, we call it as binge drinking. And binge drinking is everything, like a drop of alcohol is dangerous, but binge drinking is more dangerous. And when we
Okay.
call it as heavy episode of drinking, when somebody consumes more than 60 gram of alcohol on any occasion,
Hmm.
but sometimes practically it is very difficult to calculate how much patient is having alcohol, no, because they have different combination of drinks, and it's becomes difficult. So coming to the epidemiology of alcohol related diseases, it accounts for 6% of global deaths, and the disease burden
I
is.
think I'll think we'll leave the epidemiology and go to the liver transplant
Yes, ma'am.
for
So
want
we
of time.
discussed
Yeah.
about this. Approximately 10 to 35% of the heavy alcohol drinkers will develop cirrhosis of liver.
Hmm.
And we discussed about that alcohol, apart from liver, it also affects the heart, GI, and it also increases the risk of cancer, including liver cancer. So the various stages of that we have discussed. There's something called as acute alcoholic hepatitis. We see patients suddenly coming to us who had back to back. They were drinking for a couple of days, maybe 10 days, too much, and then suddenly they develop jaundice and they come to us. We call it as acute alcoholic hepatitis. We also have something called as acute on chronic liver failure, and then obviously we have chronic liver disease patient. And currently, if you see worldwide, significant number of patients are listed for liver transplantation secondary to alcohol. Till today, hepatitis B is still number one, and then currently alcohol is second. But if you see in India, probably alcohol is the first cause, and then other things are caused second. So we see a lot of patients with alcoholic liver disease who needs transplant. So ethical dilemma we discussed. We always, whenever we have patients who are actively consuming alcohol and they come to us for transplant, we decide whether they really need to get transplant done, because you do a transplant, they go back and drink again. The whole
It's no
exercise of
use.
doing a transplant is of no use. But at the
Yeah,
same time, people can reform, so we also have to give them a chance to survive.
chance.
There may be a young guy may have a family who wants to see him alive and who want them to support him. So
Now,
we
when you
cannot.
said about the reform, I remembered a joke.
Yeah,
The fellow was almost in the terminal stage and he started praying to God. And he was so sincerely prayed, the God came. And then
yeah,
he said, "Oh God, I don't require anything now. In the
yeah,
next Janma, you don't give me any teeth. I don't need 32 teeth, but give me 32 livers so that I can drink. So they do not reform.
yeah, yeah. There's serious problem about recidivism in these patients, ma'am. So
Yes.
generally, what used to be followed before was 6 months of abstinence. So if somebody has a liver disease,
Hmm.
needs a transplant, we used to wait for 6 months to
Months
make sure
abstinence.
that
That he's not
they
going to
prove
start drinking again.
thinking.
Okay.
And but unfortunately what has happened is that 6 month period is very long, and many of the patients die
And they may
within
not
2 months.
survive
Yeah,
at
so
that
now
time.
things
Yeah.
are changing. In selected patients we are doing early liver transplant also, but obviously there are strict selection criteria for that. And we need to
Mhm.
understand that severe alcoholism or alcohol dependence is a psychiatric problem.
Yes.
Everybody who drinks alcohol doesn't land up in liver diseases or alcoholic hepatitis. There is a lot of psychological component also, low
Mm,
social support that also is there. So
mm,
nowadays we are little bit we are pro for doing early transplant if we are sure that patient is not going to go back to alcohol and there is a good family support and they have a lot of motivation.
mm,
So, but we still need to understand that good number of patients go back to alcohol after transplantation, and it
mm,
can be up to 40%. And I have
mm,
myself seen patients who have undergone liver transplantation going back to alcohol and coming back to us with big problem. Lot
mm,
of we have difficulty to tell people that this
mm,
is what has been done, and unfortunately he has
mm,
had same problem.
mm,
And once
mm,
they relapse, they have very high mortality. And
mm.
then the whole question comes, why did we do transplant at all when we knew that
Correct. Correct.
this thing is because they are not going to
Like it's
survive
a
after.
waste. It's a waste. Yeah.
It's a waste exercise. So, alcohol, we know in brain it causes brain atrophy. They have cognitive decline. We know about Wernicke's encephalopathy. Alcohol causes cardiomyopathy in heart. They have
Yes.
arrhythmia, as you told. They can have hypertension, and many of these problems will interfere in liver transplantation if they
Yes.
are serious. There are also things called pancreatitis. We can have patients with GI bleeding, which you
Yes.
already told. They have bone marrow suppression. They have very high risk of getting infection. And
Yes.
the psychiatric illness, what they have complicates the scenario. They are malnourished. There's muscle wasting. You already discussed about this, and it all complicates liver transplantation. So, because if they have all these problems after transplant, also it is going to linger on. So, and patients undergoing transplant after alcoholic liver disease at high risk of cancer. So, just because you had a transplant doesn't mean that you are cured of it. You have to be on regular follow up for these patients.
Mm, mm,
Outcome of liver transplantation in patients with alcoholic liver disease, it's not bad. It's as good as for any other disease. In brief, I briefly told you about severe alcoholic hepatitis and early transplant. Nowadays we don't wait for 6 months, we also do transplants early. But make sure that we have to make sure that they have good psychological support. We do good behavior intervention that they don't go back to alcohol. So in conclusion, ALD is a growing liver transplant challenge. The eligibility criteria is standard. These patients need disease-specific pre-transplant screening like cardiovascular screening, nutritional screening. They need very good psychological support, de-addiction, family support, social support. They have to be on close follow-up after transplantation. Selected patients of acute alcoholic hepatitis can be transplanted. We just don't have to go by that 6 month abstinence period. Best outcome depends on strong family support, the caregiver, the motivation, and multidisciplinary care by the doctor. So that's in brief about the role of liver transplantation and alcoholic liver disease. Now we can take questions.
Okay. Now I would like to ask you the question that, who can donate the liver and how much liver do you take in order to
So, ma'am, if you go by we have a Human Organ Transplantation Act. So anybody who is related to the patient can donate liver for him. So we classify them as first degree relatives and secondary relatives. First degree relatives are immediately related to them, like wife, husband, children, mother, father. They are first degree relatives, like brother and all. But if you have somebody further than that, we call it a secondary relative. So all these people
okay,
can be a live donors. Cadaveric
okay.
donation is anybody who has registered, or if somebody has brain dead and the family is willing to donate, so all those people can be a cadaveric donors. So we basically
No,
have live donors.
no. Why I ask this question is, during the transplant committee meeting, a man, 70 years old man, had come for the liver transplant, and his daughter-in-law, who's 32 years, she was donating, and the mother of two children, and
Yeah.
my heart went out to that girl. And
Yes.
whatever they say, no, she's not forced or whatever it is. The son is not giving, wife is not giving, the others are daughters are not giving, but the daughter-in-law is asked to give. And that time, I put my foot down and I said no, but all others agreed. And that is the reason I'm asking. And here, you never know whether somebody is forced or not, and that cannot be made out.
We have
And
to make sure that there
what
is
are
no.
the risks for the donors? What is the
Yeah.
risk? Because I have heard, anecdotal maybe, but still, a donor also can die due to the peritonitis or something, and it is
Yeah.
not safe. And that is the reason, for a 70 years old man, is it worth giving from a 32 years old lady? That
Yeah,
is
ma'am.
my
So
question.
yeah, yes, ma'am. So basically, if you like in US and all, or in UK, if somebody is above 65 years,
Hmm.
then transplant option is not there.
Okay.
Cadaveric listing and all
I
are
think
not.
that also has to come in India, the
Still
70
now
years
in
old
India, we
man,
don't have
yeah.
a, yeah, we don't have a upper limit for age
Hmm.
in India per se currently.
Hmm.
And about there's a lot of ethical dilemma, ma'am, especially old people. If some youngster is donating, as you said, you are rightly said that the committee makes sure that there is no coercion involved, there is no undue pressure on anyone who is willing to donate. That's why we have an independent committee we go through, and then there are eminent people who have so true concern about. We also have, especially if you are in Western countries, no, you also have donor advocate, like how
Okay.
you are saying that we have a donor advocate there, and who make sure that donor things are taken care of. Coming to the complications of uh, uh, complications to donor, ma'am, it only comes in question in living donor liver transplantation. In
Hmm.
cadaveric transplantation, the person
Of
is
course,
already brain dead,
brain dead,
so
and yeah, that's
so
no
in that
problem.
question doesn't come. But living donor, ma'am, we need to understand that no surgery is safe. So no surgery is safe. Every surgery comes with some complication, be it cesarean section, be it cholecystectomy, be it
Hmm.
cataract surgery. Every surgery comes with
I know, I
complication.
know.
So living donor, live donor hepatectomy also comes with complication, but the risk of complication is very low, because the people who are doing it are very, very careful, because we know that it's a high stakes surgery. So we do thorough evaluation before surgery, and then during surgery we take a lot of care to make sure that it's all fine. So but complications can occur. Majority of them are minor complications like wound infection, hernia, some minor bile leaks, but
Okay.
even
In
there are
the,
situations in which,
living donors, in the living donors, how much liver do you take? Because,
but
suppose the person has got an anomaly, single hepatic vein is there, you cannot dissect, and then that is a contraindication. So,
yeah.
what are the indications and contraindications for both the donor and the recipient? Please tell
Yeah,
us.
ma'am, recipient contraindications, ma'am. Recipient should be fairly fit enough to undergo liver transplantation and withstand it. So, if the
Okay.
patient is not fit enough to withstand, then we don't do. If they have serious cardiac problems, and if
Hmm.
they have serious infections, or
The pulmonary
somebody who is,
hypertension and
yeah,
varices, and yeah.
yeah, we don't take them. And then if somebody, for example, in alcohol per se, if they are severely addicted, and you have done all the evaluation and you know that this patient is unlikely to stop alcohol, who don't have proper support, who don't have insight into the disease, who are not compliant with the treatment, because after transplant they have to take immunosuppressant lifelong. Such are the patient that is a contraindication for transplant as such. For donor contraindications, they have to be major people, like they should not be like, they should be more than 18 years, and then they should be within 50-55. So it is more than, like, if they are
Okay.
younger than 18 or older than 50
That
55,
not under.
if they have major problems like hepatitis B, hepatitis C, or any health issue, then they cannot be donors. And as you told, if they
If
have
they
any
are diabetic,
anatomical,
if they are diabetics or this thing.
if they are if they have uh, well controlled early stage diabetes, we can take it, ma'am. But obviously poorly controlled and uncontrolled diabetes,
Because fatty liver can occur in them also,
yeah,
no?
yes,
Well,
ma'am,
so,
yes. So they are, that is a contraindication, hepatitis B, C. And you said on CT scan we do we see all the anomalies, and then if there is something which is not favorable, we don't do it. The amount of liver we take, ma'am, it depends on who is the recipient, child or adult.
okay.
If it is child, generally we take left lobe
Hmm.
or left lateral lobe, depending on the weight of the
Okay.
baby.
Okay.
For adults, generally we take the right lobe, and when we are taking
The
right
right
lobe,
lobe is quite big, no?
big right
So
lobe
it
is
is
big.
more than 650 or so.
Yeah, yeah.
It's
Mm.
quite big. But
Yeah.
nothing will happen to the donor if we are taking
No,
a
ma'am,
big chunk of the right lobe.
we make sure that at least 30% of the liver remains with the donor.
Okay.
If the remnant is less than 30%, then we don't accept them for a donor. At least
Okay.
30% has to be left with the donor. And then
Okay.
obviously when 30% will grow fast within couple of days to the requirement of the body. But at least 30% is required to sustain the person for few days till the liver regenerates fast.
Yeah.
Minimum is
So the
required
liver is the only organ which regenerates, whereas the heart and the brain they don't.
don't regenerate.
Yeah.
Yes, ma'am.
Yeah. Yeah. Any questions in the chat box, Ankita? No,
This
let us
one, ma'am.
forget. What are the factors predict post-transplant alcohol replace, and how are these risks assessed before listing?
Ma'am, basically, after whenever we are doing a transplant for somebody who has liver disease secondary to alcohol, so they basically undergo a thorough evaluation by our psychologist and psychiatrist and behavioral therapist, and they have a lot of questionnaire and they have different scores, and then they will tell us whether they will also look at whether the patient has insight or no, they are motivated or no. They also look at the family support, the previous history of the patient, the adherence to the medications, and then they tell us whether the patient is going likely to be not like likely to not go back to alcohol or likely to go back to alcohol. And if
Okay,
we
okay.
feel, when they firmly tell it is very very less likely, nobody can be sure, but if it is good
Yeah,
family
yeah.
support, patient has insight,
Addiction is like that. Yeah,
yeah,
addiction is like that.
the pattern of
Now,
drinking, how long
yeah,
they have been drinking, all these things will tell us whether
okay.
they can go back to alcohol or no go back to alcohol. If they don't, if we're fairly sure that they are not going to go back to alcohol, then we go ahead and transplant them. So that's the.
So the next question is, what specific perioperative and post-operative challenges are commonly encountered in patients with the alcoholic liver cirrhosis undergoing liver transplant?
Yeah, so in them, ma'am, the
You have
nutritional
already
factors.
enumerated some
Yeah,
of
yeah.
them, and then you can
Cardiac
summarize.
problems, they may have cardiomyopathy and all, and then
Hmm.
nutritional problems they can have.
Then the delirium tremens will be there, and then
All
the
those things
brain
are the
also will be, yeah.
problems. We have to pick it up early before transplant and try to optimize if possible. And if it is not possible to optimize, then probably it is a contraindication. Apart from psychological evaluation, social
Yeah.
evaluation, and all those things.
Yeah. Pawan, do you have anything to add? Before we conclude, we have come to the end of the session. Yeah. Anything?
Nothing, ma'am. I think it's already.
Okay.
Yeah. So
If
I think
yeah,
everything has been
okay.
covered. So,
Okay.
There's one
Then I
question
would
in
like
chat
to
box,
I
I
would like
think. There are some
No, no,
questions
where
in
is it?
chat box.
no, no,
Where is
there
the
are
chat box?
many, but it's okay. So in that case, I thank both of you for doing such a wonderful job. And before I conclude, I would like to tell, in Rigveda, that is the oldest Veda, Pancha Mahapataka is given. That means five greatest sins. Out of them, Surapana is one of them. So that is so bad. So if you take in a dharmic way, that is not. And if you take scientifically, as medical students, when we study in pharmacology, alcohol is a depressant. So they used to give example of Devdas, goes into depression, drinks, and because of drinking, again further depression. That's a vicious cycle. This people should understand. And the third thing is alcohol, according to our constitution, it is banned. But still, people are freely drinking, and at what cost they have to think, because life is so precious and it is meant for living and enjoying and not destroying yourself. So I think the younger generation should realize that what they are doing is not right. And then after listening to both of you, I hope it is an eye opener for them. And thank you very much for both of you. Probably we'll discuss some other topics relating to this in the future. Thank you very much.
Yes.
Thank you
Thank
so
you,
much.
ma'am.
Thank you.
Thank you.
Thank you, ma'am. Thank you to both our speakers. That was a wonderful session, and I hope that will be an eye opener for many of our viewers. So, with that, I would like to conclude our session for today. Thank you, everyone.
We have
Bye
finished
bye.
on time,
Thank you.
dot on time.
Yes,
Yes.
yes, ma'am.
Very good.
Thank you,
Thank
ma'am.
you.
Thank you.
Thank you
Bye.
so
Thank
much.
you.